Yes, my people, everyone that will be in the chat as we start, uh, requested to do some emergency responses to head injury. Some people requested we do some emergency response to head injury because it's a topic of importance. Head injury is a topic of importance, and as we saw that you can get a problem, you can slide and fall down. You can slide and fall down and have a head injury at home. Something can come from nowhere and hit you, and then you get a head injury. So the requests have come. I'll go through types of, yes, I'll go through some types of head injury, and I'll go through the emergency and first aid to my- to head injury. So I think it will be a short session because it's just one topic without explaining deeper. But sometimes when you do pathophysiology, you go deep on some issues, it makes the lesson be so long. So tonight here it is at 9:37. Come earlier than promised, and I'll be on point and at task to give you some tips on how to help yourself when you are home, when you are home on some emergencies that occur. Because if you if you harm your head, if you harm your head, you know what will happen. Paralysis will come. We did about we talked about some issues concerning the so on is about a question that was not related to this. So we put it aside. We put it aside like that. If we check that picture that is behind me, one of it is for the heart, and this one is called the Circle of Willis. This one is how uh, how can I say it? This one is about how blood supply comes from your heart to the brain. There are several things we need to do and to know because brain injury means the nerves of the brain and the blood supply is deteriorating. The nerves of the brain and the blood supply is deteriorating. If that is what brain injury means, what can we do to help when there is an emergency? Just before I go on, you will find that look down here, this is the heart. This is the heart, and I will show something here. And you see, above this is they arise from the outer, they arise the left common carotid artery, and then we have the right common carotid left subclavian artery, and the left right subclavian artery. We have brachiocephalic artery, but we have another one here, which is called the right common carotid artery. So when you have the left and the right carotid artery, look at that picture. So let me put this thing this side so that you can check out, you can learn about this left and right carotid arteries. Check out. And to show you a good view of it. Bring this one here. I think this one is better. So from the carotid arteries, from the outer, we arise some vessels that take the blood to the brain from the carotids. This one is your head, but we have something here which is the heart. So at the heart levels, these arteries that are coming from the outer, you can look at them. There are some arteries that they come from the outer. This one is the left common carotid artery. Then we have brachiocephalic. We have the left or right subclavian artery. And this side we have the left subclavian artery and the right common carotid artery. You get it? Right common carotid artery. Now, if you come here, those that I've named, you will find that this left and right common subclavian arteries, they are the ones which are coming here. They are the ones which are coming here, the carotid arteries, and serving the brain. So it is important that you note that any damage to these arteries, is what leads to head injury. And we have to know when you get a damage to any of these vessels, or you start seeing signs of a person that is having damages to these arteries that I've said. You see, they are here. The carotid arteries, vertebral arteries, they always come from the outer branches of the carotid. From the heart, they arise and then they go to your brain. Now, we have to check on some issues that are so important when we are talking about the carotid arteries and the brain. The carotid arteries and the brain. It is so important that we learn about the carotid arteries and the brain and the emergencies. Now, because this is the topic of injuries, we go directly to injuries. We go directly to learn about injuries of the brain. There is injuries of the brain that we call compression, contusion, and we're gonna see how they are. So the first head injuries can be classified in several ways. Head injuries can be classified in several ways, and several ways depending on mechanism, severity, and type of injury or damage. You get it? Head injury can be classified on type of injuries and damage. Here is the breakdown. When you are beaten by a closed thing, blunt thing, and then you get injury inside, that is called a blunt injury type. Blunt injury. It will not cause an opening, but will have damage inside your brain. The skull remains intact. The skull will remain intact. No open wound. There will be no open wound in the skull, but brain injured due to impact or shaking. See, when you hit a brain, the head, when you hit the head, I think I want people to see that. When you hit the head, let's say with a blunt oxygen, you have hit this head with a blunt oxygen. The pressure, although it will go, we said we have cerebrospinal fluid that is cushioning this head. That pressure will cause the brain to get another pressure through transmission from the cerebrospinal fluid. And then the impact can cause brain injury. So concussion, that is what we call concussion. Concussion is when you beat someone with a blunt oxygen and then the head gets a concussion because through the cerebrospinal fluid, it hits the brain. Brain is having tension from the cerebrospinal fluid. Contusion is whereby the brain gets bruises. Eh? This is a blunt oxygen. Hmm? It is called diffuse axonal injury. Diffuse because it is spreading through the cerebrospinal fluid. That is the first type of head injury, the first type of head injury. And then we have open penetrating head injury. When you hit and the skull is fractured and or penetrated in, the skull is fractured and penetrated in. The brain exposed to external environment, e.g., gunshots, hmm, sharp objects. You get it? Sharp objects, gunshots, sharp objects, injury. You get it? When you get sharp objects that like a knife, sometimes if you get a gunshot, it can with a small firearm, it can get to the brain and then you get it is stuck. Or a knife can get into the head and then it starts on the skull. You get it? So that is open penetrating head injury. I have to classify so that when we are doing first aid, we know which type of first aid we are doing. We have said based on that one is penetrating. Now, when we go to based on severity of head injury, how can we classify it? We can classify it by saying, we move here. We can classify based on severity by saying brief loss of conscious. Yes, tulips. Hello, welcome to the platform. I'm doing head injury, and then I'll do a short uh, first aid on maybe you have a person at home and then this person gets a head injury. You get it? Now we will get here to say that we have based on severity. So if it is mild head injury, you will lose brief consciousness, or sometimes you may not lose even the consciousness. You get it? Symptoms like headache, dizziness, and confusion will be there. Hmm? I think writing these things down helps so much because some people are taking notes. So if you are coming in, please give me some likes. Give me some like. Don't forget to like so that we get some good impression. Now, we have said head injuries. One, it is based on injury type. It's head injury. They are classified. Let me get another. They are classified. I want to write so maybe someone is taking notes and that person may follow up so that I get a board. I think this is important. I get a board so that we can be taking notes and writing notes on the board. So, but for now, let me do whatever I can do. Okay, there. Are we saying something? Now we have said let's see, head injury. Injury. The first thing we have said is it's based on injury type. That is the first. How we classify head injuries. So the second thing we have said is based on severity. Is it mild? Is it mild, moderate, moderate, or severe head injury? Good, severe, severe head injury. So, what do we say mild, moderate, and severe head injury? What do we say this person has a mild, severe head injury? When we say this person has a mild head injury, sometimes it means that this person just had some loss of consciousness and then this loss of consciousness resolved within some time. You get it? Resolved within some time. But when you get moderate, what do we mean when we say this person has moderate head injury? Loss of consciousness for minutes to hours. High and sometimes neurological symptoms. When we say neurological symptoms, what we mean is this person lost consciousness, and after losing consciousness, what happened is maybe speech was not there within some. Yes, Beauty, welcome to the platform. We are dealing with head injury and first aid at home, how to handle first aid at home. So maybe this person could not speak, or eyes, was not seeing well. You get it? That is moderate. And then after some time, it resolves by itself. You get it? That's when we say he had a moderate head injury after losing some speech, and then you come and resolve after some time. It says it is moderate. I'm classifying so that when we are giving first aid, we know how to do it. Severe head injury, prolonged unconsciousness or coma. Some people go even to a coma. You get it? Some people go to a coma. Hmm? Sorry. 20. Please wait. I'm posting something so that just a minute. I'm posting something. Yes, I've got it. I have got it. Okay. So some people go to a coma, and that one is severe head injury. That one is really severe head injury. When you go to a coma, hmm, you get really severe head injury. So that is how we classify according to based on severity. You see, from some loss of consciousness or not, from 24-hour loss of consciousness to comas. That was how we classify head injury based on, and then the third one, we classify it like this, based on structural damage. Based on structural damage. Now, you can have a head injury and then the structure damages. Eh? You get cut bruises, bleeding a lot, usually not serious, but can bleed heavily at times. Skull fracture, you get the skull fracture. This is the type of brain injury that you get when you get a contusion, something that is penetrating to brain injury. And you know, some brain injuries are let me say this. There is concussion. Concussion is temporary. Where is another paper? So we have classified these things based on head injury type, based on severity, mild, moderate, and severe, and based on structural damage. If the structure has destroyed, and then you feel that your head, you are losing consciousness, that is based on structural. So we have some other terms that we use when it comes to head injury. These terms are like concussion. These terms are like concussion, contusion, contusion, and compression. So we start by concussion. What is concussion? When do we say that this person has a brain injury that is concussion? Temporary brain dysfunction, no structural damage in concussion, no visible on image. Concussion, that is when we say this person had a concussion. You get it? Just temporal loss of consciousness, and then you have that loss of memory a bit, then you come, because maybe you were hit by this is concussion. And then we have contusion, localized brain bruising, contusion, something you can see the skull. Maybe you hit something and then you can see the skull. It is called contusion because it has penetrated in the skull. Then we have something else called intracranial hemorrhage bleeding. Yeah? There is epidural hematoma and subdural hematoma. Epidural hematoma is between the epidural hematoma is epi, away from the dura mater. Subdural is beneath. So in the brain, there is something called the dura mater somewhere here. So epi is bleeding between the dura mater and the skull, but subdural is beneath. You get it? Epidural and subdural. I have to post something and I'm late. If you are watching, just give me a second, please. I place. Number 17. Just a minute, guys. I got something here. Yeah. Playlist. I'm posting a playlist here of some issues. Okay. Guys, if you are watching, just a minute. I do this. I do this thing. Okay. Okay. And now we continue. There is something that I wanted to say: epidural and subdural. Epidural and subdural. Epidural and subdural. In the brain, there is something called the dura mater. You remember when I was saying something concerning the when I was saying something concerning blood-brain barrier. So there is something called the dura mater that protects the brain and the skull. It's a epidural hematoma between the skull and the dura mater. So between the skull and the dura, you can bleed between the skull and the dura mater. Yeah? Let's say the skull is the green one is the epidural, and the dura mater. You get it? So you can bleed between the skull and the dura mater. Subdural is beneath the dura mater, and then we have something called the subarachnoid matter. So I put a subarachnoid matter here. Subarachnoid matter. So that is it. And then when you do a CT scan, you see something that is protruding from inside. From inside, you see something that is protruding there. It is yes, we continue now. You see, those are the things we see when it comes to head injury. Confusion, and compression. Compression maybe if you have something that is growing in your brain and it is causing some compression inside your brain. You get it? That one is how we We do what? We classify head injuries. That is how we classify brain head injuries. But there is something called diffusion axonal injury, severe shearing injury from rapid movement, like a flying bullet. This one is mostly in road traffic accidents. When a bullet or you are moving in a car and then you hit your head so hard somewhere. You hit your head so much somewhere. It brings the Rogers. Yeah, yes, Rogers. Yes, sorry about that, my guys. Sorry about that. Now we go now to deal with head injuries. We go now to deal with head injuries. Um, we go now to deal with the head injuries themselves. First aid on head injuries, which is so important. Hello, King Ray. I see you are here. I'm being distracted by several calls and messages, so I have to act on them. Now we check on the emergencies that we can get on head injuries. The emergencies that we can get on head injuries. Head injury is something that can make you lose life or be disabled forever. So if it can make you be disabled forever, what can we do? What can we do to help a person who has a head injury? What can we do? Now, there is something called primary assessment. Primary assessment of ABCDE approach. You see, you check the airway with cervical spine protection. When you go to somewhere or you get someone has hit his head and is lying down somewhere, what you should do, you should not go there and let the people carry that person anyhow. What you should do is you should get something that is tough, flat, and put that person on that thing so that you protect, make sure the spine is protected the way it is supposed to be protected. Because when we are helping a person who has collapsed, We are not just helping the airway. When I'm saying A, B, C, D, we start with airway with cervical spinal protection. You don't take the head, it is lying this way, and then you are carrying a person. No. Assume the cervical spine injury in all head injury. If someone was walking and hit himself on something and fell down, always assume maybe he might be having spinal injury, because the way you handle that person from that day can make that person paralyzed forever. Like if you handle that person and destroy the nerves that are, maybe there was a fracture on the spine, and then you handle that person in a wrong way, the fracture of the spine can injure a nerve and that person will be paralyzed forever. So when you are taking care of, or you are at an emergency area and you see people that are not trained, chase them away. Even in an accident, wait for our emergency responders, because there is a way to retrieve people from an accident area. And when we are retrieving people from an accident area, we are retrieving them with a style so that we can protect the spine and the airway. So stabilize the neck using cervical collars, yes, or manual line immobilization. Ensure airway patency. Ensure that this person is breathing or air is going through the chest. Check for obstruction, and obstruction can be blood, vomit, or tongue. Sometimes the tongue can retract and it blocks the airway. Breathing becomes a problem. Suction secretion is needed. As you are protecting the spine with the cervical collar, you can be using suction. If there is secretion like sputum, blood, you continuously remove them and you stop the bleeding. Consider airway adjunct, oropharyngeal and nasopharyngeal, nasal and oral. To unconscious people, try to intubate. This is for doctors, not anyone, to get the breathing going on. Now, we have said it's ABC. We have said it is ABC. So you are at the accident area. You are with that person there. Check the breathing. Is this person breathing? Assess respiratory rate. If this person is lying down and you are there with that person, this is the head injury now, but we are talking about how the breathing is going on, because now breathing is controlled from the brain. You check the respiratory rate, count how much you see the chest is going up and down for how many minutes, like like 15 seconds, then multiply by 4 to get the respiratory rate, because you want to save life faster. You want to save life faster. So count 1, 2, 3, 4 for 15, the number of chest that is pumping and going down, pumping and going down, then multiply by 4 to get the respiratory rate. That is, and administer supplementation of oxygen if there is. Watch for kind stroke or irregular breathing, or sometimes we call it, we say Kussmaul breathing. You check for such breathing. Hyperventilation is important. Check for hyperventilation. It's only temporary, but you'll see after you've stabilized, the breathing might come, unless this person is having an internal breathing from inside. Circulation. Check for circulation. Circulation is where you have seen people coming and touching this carotid valve here, or sometimes this pulse here. You check if it is pounding. If it is not pounding, that is it's an emergency. Look for signs of shock which may worsen cerebral perfusion. Establish IV access. If you are a doctor there, you have an IV line, put an IV line. And then you will check for disabilities. You have found a person lying down. You check for disabilities. There is something that the doctors use, it is called Glasgow Coma Scale. You check the eyes, the verbal and the motor response. Are the eyes responding? Is this person responding to you in a normal way? Is he using normal ways of responding to you, or is having uncontrollable words and incomprehensible words? Is the altered sense of the mind, is there altered sense of the mind by the verbal response? You see, it is called the Glasgow Coma Scale. Check the pupils if they are retracting or not. You get it? Check the pupils if they are retracting or not. But sometimes even a person can get a head injury and starts to convulse. Have you found any secretions from convulsions? Because some people, when they convulse, you get secretions. You see, you can hit a person head and then this person convulse. Check the limb movement asymmetry if this person can walk. You get it? And then exposure. Expose the patient, check for injuries in the body, because now you are not sure after the head injury what happened. Maintain normothermia, prevent hypothermia. That one I'm saying, always prevent this person from getting hypothermia. Hypothermia means low temperature. He should be warm. Low temperature can worsen coagulopathy. Low temperature can make this person to worsen coagulation. You get it? It can make you worse in coagulation. So where there is secondary assessment, if you know this person, or you are in a hospital setup whereby you identify allergies, medication. Sometimes when you get a person is unconscious somewhere in the house or outside there, you try and check the pockets, or you try and check the environment. Is there any medications like Ventolin inhalers? Is this person asthmatic? Check around. Maybe you may find he's taking some antidepressants around where that person is. Ask from the other people, this person, what is the past medical history? Is this person psychotic? Is this person has a history of seizures? Those are things you should ask. Yeah? What last meal did this person take? Maybe you can find vomiters there. And you ask, because they will give the doctor the lead on how to start. Events leading to injury, how did it start? Did he convulse that? And did this person have a seizure and then he fell down? Or did this person hit something? Or were they fighting? Were they fighting so that he fell down? Those are the things someone should ask when you find someone is unconscious. Head, vomiting, loss of consciousness, amnesia, things like those ones. They are very important when you are dealing with, you found someone that is unconscious. And then we check the physical examination, check the head and scalp for lacerations, swelling, and bruising. Just check the head for lacerations and swelling and bruising. Lacerations are wounds. They can help you know that this person had a fight, or this person was hit by a blunt oxygen. Check the face. Is there any fracture, or is there any blackness around the eye? Maybe they were fighting. We call it raccoon eye. Yeah. Check for tenderness and deformities around the neck. Now, this is a person you have found lying somewhere, and some people are there watching us while the events were unfolding. We talked about the cranial nerves, motosensory function, reflexes. Is this person speechless? Are the eyes moving? The movements of the eyes. Is the tongue out? It means the nerve glossopharyngeal, the nerve number 8, glossopharyngeal, or hypoglossal. Yes, hypoglossal number 12. The nerve number 12, hypoglossal, is not working correctly. So the tongue has a problem. So if the nerve hypoglossal has a problem, you will know that there is head injury. That's why sometimes people fall down and the tongue comes out. Raised ICP, raised intracranial pressure. You get it, headache, vomiting, bradycardia, hypertension, irregular respiration. This one, it's within a certain thing called Cushing triad. Get headache, you start vomiting, then bradycardia, low heartbeat, and irregular respiration. See, when they go to hospital, they are done blood tests like full hemogram, imaging, and others like ECG in older patients. Get it? Initial management, stabilizing is very important by fluids. If this person has a seizure, this is in hospital, there will be something like levetiracetam, or phenytoin to reduce the fever. If the person is okay, the Glasgow Coma Scale is 14, they will give something like analgesic to prevent the pain. Sometimes pain can make your BP go high. You understand that? And then we have analgesics like avoid opioids in large doses. Opioids. Initially, if there is a problem with the nerves and you are unclear what is causing, always use normal paracetamol for mild pain. It's very important. Always use paracetamol for head injury because opioids and steroids may worsen the situation. Prevent secondary brain injury by maintain adequate perfusion within the within these arteries that are supplying the brain with oxygen. You get it? That is D. Yeah? A, initial management. A, stabilization of raised intracranial pressure. Give, if this person is having a seizure, reduce the seizure. Give analgesic, reduce the analgesic, give the analgesic to reduce the pain. Prevent head injuries, secondary brain injury, because a person may come in hospital with brain injury and then you give a lot of fluids, he gets another secondary head injury because of high BPs. We don't want that. Avoid hypoxia, hypotension, and hypothermia and hyperglycemia. Make sure that this person has no low blood glucose in the system. You get it? Monitor fluids balance and electrolytes. Monitor fluid balance and electrolyte. That one is done in hospital. And after everything is done, you start monitoring for 15 to 30 minutes while doing the GS glycocoma scale, checking the eye movement, motor movement, muscles, and speech. Is this person talking to people? You get it? Vital sign is important. Check the BP, the heart rate, and SpO2, that is oxygen levels. You get it? Indications for neurological intervention. Epidural hematoma, the one that we have talked about, subdural hematoma, and depressed skull fracture, brain herniations. Now, those are things that are done in the hospital. Now, what can we do when it is at home? What can we do when you find a person has a problem and is at home? First aid at home. What can you do? Because sometimes you get these problems at home. First aid at home. It is very important we know what to do when it is at home. You just make sure the environment is safe. No traffic, falling object around that person. You get it? When you find a person unconscious, make sure there is no people around that will make oxygen around to go down. Do not move the person unnecessarily. You get it? Especially in the neck. Don't move that person unnecessarily. Now you have gone home, you find someone is unresponsive. Not move the neck unnecessarily. Check responsiveness. Gently call the person and tap them like slowly as you call. If unconscious, treat as an emergency. Don't try to give milk or water or pour water to that person. Call an emergency team of professionals. Call an emergency team of professionals. And airway and breathing. Check the airway. Is this person breathing? Place in recovery position on the side. Let this person lie on the left side and the other leg on. You get it? Only if not suspected neck injury. Protect the neck. Assume neck spine injury in all. I've said that in all head injuries. Control the bleeding. If you find this person is bleeding, please control bleeding. If you find the person is bleeding, always control. Try and stop the bleeding. Reduce swelling by applying a cold compress of ice to reduce inflammation. I talked about inflammation, about the prostaglandins, how they work. Watch closely to the next 24 hours. Go to hospital immediately. These are things that you are supposed to do at home, the ABCD of home. And you know, they're at home, you can find some warning signs. And these warning signs are like loss of consciousness, repeated vomiting, severe or worsening headaches, confusion, abnormal behaviors, seizures. Seizures is a warning sign of head injury. Weakness in the arms, unique unequal pupils that are not looking well, blood or clear fluid from the nose. If you find someone that has a clear fluid from the nose, don't say it is a sputum or running nose. No, it may be something called cerebrospinal fluid coming from the injury from the nose. So always pack it and don't tell the person to blow the nose. No. Difficult walking and exercise and drowsiness. You get it? Slurred speech. Keep the person calm and awake. Let them rest, but do not let them sleep immediately. There are things that you should do. Avoid harmful actions. Things to avoid when you find someone is lying down and just has a head injury. Do not give alcohol. Do not give strong painkillers like opioids. Avoid unnecessary movement. Do not shake the person. A person with head injury is not shaken as you wish and is not moved always, because you may destroy the nerves from your neck. Then pain relief, we have said just give paracetamol until this person is in hospital. Don't give. Avoid aspirin because it can increase bleeding. When to seek medical help is the person was unconscious. Call 911. Injury from road traffic accident, from fall from a height or assault. They were fighting and he was hit in the head, or symptoms are worsening. Please call 999. The injured person is a child or elderly. Every head injury of a child, run to hospital with that child. Every head injury from an elderly person who is above 65 years, run to hospital with that person. Those are the normal ways of first aid at home. I think right now that we are at par. Those that wanted this video of home, it wasn't a big lesson today. You've heard, and the others can watch and know how to handle a person at home. So everyone, stay cool and well at home as Easter is coming from tomorrow. Tomorrow is Good Friday. Thanks a lot for those who have come to the challenge. We will see if we can have a talk tomorrow at 16 hours and 30 East African time, the normal time, as we continue with our chat on cardiovascular issues. So sleep tight, everyone. Bye. See you tomorrow.